Our last question, what do I do when a patient with autoimmune hepatitis has a flare in liver enzymes while tapering or after stopping immune suppression? This is the most common question I get from referring gastroenterologists who are trying to manage patients with autoimmune liver disease. Now, the primary treatment for autoimmune hepatitis is prednisone, with or without an antimetabolite, such as azathioprine, 6-MP, or mycophenolate mofetil, also called Cellcept. The starting dose of prednisone is typically 40 to 60 milligrams daily, and the dose is tapered every few weeks down to 20 milligrams. In patients with severe autoimmune hepatitis and very high liver enzymes, greater than 1,000, and jaundice, it'd be perfectly reasonable to start at even a higher dose of prednisone, such as 80 to 100 milligrams. The second drug can be started at the same time as prednisone, and this is done in somebody with really severe autoimmune hepatitis, as I just mentioned, very high liver enzymes and jaundice. Or you can wait to start this second drug until you're lowering the dose of prednisone, but it's typically added when you get to 20 milligrams daily of prednisone. Azathioprine and 6-MP are utilized at doses of 50 to 100 milligrams a day, and mycophenolate is typically at 200 to 500 milligrams twice a day. The bottom line is there are a lot of ways to treat autoimmune hepatitis, and typically, no matter which way you do it, it usually works. The goal of treatment in patients is to normalize the liver enzymes. Then you taper the prednisone down slowly and try to finally take the patient off prednisone and leave them on no medications or on a non-steroid antimetabolite long term. There are basically two mistakes which physicians typically make, that lead to flare in the liver enzymes during the tapering process or after you stop prednisone. The first one is tapering the prednisone below 20 milligrams when the liver enzymes are not normal. And the second is stopping the prednisone too soon. I strongly advocate maintaining the prednisone dose at 20 milligrams a day until the liver enzymes are normal. If the liver enzymes are still elevated with 20 milligrams of prednisone, the patient is not on a second drug, now is the time to add that second drug. Sometimes the liver enzymes will normalize rapidly within just a few weeks on prednisone alone. Sometimes it may take 2 drugs in several months. You have to be patient. That is the name of the game in autoimmune hepatitis, patience. Once the liver enzymes are normal, I typically wait about 3 months and then reduce the prednisone dose stepwise below 20 milligrams down to 10 milligrams. The second common mistake that leads to relapse or flare is to reduce the dose of prednisone below 20 milligrams every few weeks and stop prednisone completely within just a few months, or to try to get that patient off prednisone as quick as possible. Again, the disease requires patience, and in my experience, breakthrough or relapse occur when you bring that dose down too fast. So my rule of thumb is when your liver enzymes are normal, you bring that dose of prednisone down from 20 down to 10, and you keep the patient on 10 milligrams of prednisone for several months. You want to keep the patient on prednisone from the start of therapy, whatever you started at, whatever dose, till you take them completely off for about a year. So about 5 or 6 months of 10 milligrams, you can then start to reduce the dose of prednisone below 10 milligrams down to 5 for a month, then to 2.5 for a month, and then stop, or you can go to 5 milligrams every other day for a few weeks before stopping. The goal is patience. Don't take the patient off too fast. Don't lower it down too fast, because if the patient is pushing you to get off prednisone too fast and then they relapse, what are you going to have to do? You're going to have to go all the way back to 20 milligrams and restart on recycle therapy and get the liver enzymes normal on 20 milligrams again. And then the patient who wanted to be off steroids is now going to be on steroids for longer. Just tell them they have to be patient. I hope you've enjoyed the answers to these 4 commonly asked questions on hepatitis, on the topic of hepatitis. And you can look at the CLDF website for additional questions and answers on other topics of liver disease.